Kevin, why are you here at the rally for single-payer health care today?
Because right now we're seeing a crisis in healthcare in the United States. 22,000 people are dying annually because of lack of health care, according to the National Academy of Sciences. No other country in the world can say that. We're spending more per person than any country in the world, almost double every other country in the world, and we don't have the best health care. We're not even in the top 10 in the United States, so it's one of the great falsehoods. So I'm here today to advocate for a single-payer health care system, expanded Medicare for all, so that everybody has health care from birth to death.
Now, the other day at the Senate Finance Committee, you and 7 other activists were arrested because this Senator Baucus was barring the single-payer people from speaking. What was that about?
Senator Baucus and the Finance Committee have been bought off by the insurance industry, the HMOs, and the pharmaceutical industry. They just will not even allow the views of the most popular healthcare reform in the United States, single-payer healthcare, supported by more than 60% of the population, more than 60% of doctors and nurses and economists, and it's not part of the discussion. And so we decided that we had to stand up and say enough is enough, and 8 of us stood up and said we want to have single-payer on the table as part of the discussion.
Now, even after you took that action, there have been other hearings, and he still persists in not allowing single-payer. So what does that say?
A week later, 5 more people were arrested because healthcare is not allowing single-payer to be on the table, so we're not being heard. It says that they're afraid of the topic. The hearing yesterday where people were arrested was about finance. They're thinking about now taxing healthcare as income to the working people of the United States, rather than facing up to the real source of the problem, 30% of the cost, which is the health insurance industry. We don't need them, and they're 30% of the cost. They're making $1 trillion a year on health insurance. We need to stop that from happening, take the profit out of healthcare and make this a commodity that people get because they need it. It's a human right. It's not a profit center.
Anything else, Kevin?
That's great.